before you can say Tourette's, don't you have to have it at least 1 year?
Yes, yes.
So if someone has a little movement for a month or two, little movement of the eye, a little bit, that isn't Tourette's.
No. And I do get a lot, again, that's become a buzzword. Many parents, especially because, again, if they read on the internet, ADD children are more prone to have Tourette's than the average child. So that if their child's already been labeled ADHD or ADD and the kid has a tic, they immediately assume the kid has Tourette's, which you and I both know that could even be, the tic could even be exacerbated or caused by the medication they're on.
I discussed Tourette's with a very well-known pediatric neurologist, and he said, we use medicine, we're not sure it works, because sometimes it just might go away on its own. And he says it's something we have to look into even more, because it's maybe too many kids have been diagnosed without the one criteria that he said, 1 year. Mm-hmm. People don't want to wait the 1 year to have that done, but maybe he's right and we're wrong.
I would, from my own experience, I think he's very right, because I've had many kids come into me who someone has told them that their child has Tourette's, and but that was 5 years ago, and now he doesn't.
The rule of thumb is classical.
Yes.
Classical. The kid should have it. It's important the kid has that diagnosis for the 1 year period, yes. And you have to realize it may not be permanent. It might go away. It could be permanent.
Right.
And the medications, we're not sure how effective they are, but sometimes they'll do a trial, and maybe it'll help, maybe it won't help. But it's something that, as you and I are talking, I think in 10 to 15 years we're going to approach this in a different way.
Sounds right to me. Again, I'm getting the parents coming into me who are concerned about their kids' tics, and I say to them, my experience has been that most tics go away, and not to panic too much about it. And the only thing it does get to be if it's interfering with the kid's social life, where he seems odd and kids are making fun of him. But usually, I think if you don't overreact to the tics and you just kind of reassure the kid, I think it's manageable.
Sometimes behavior mod techniques help to some degree in controlling the tics.
Yes, yeah, there are people that do that kind of work, that they're able to they give them what they call substitute behaviors. So when they're about to tic, they touch something or grab something. And
I had one mother thought the kid was doing it deliberately, and tried to explain the kid isn't doing it deliberately. No. And that the worst thing you do is blame the kid for the problem. The kid did not want the problem. It took a while to win the mother over. She couldn't understand it, the way other kids don't have, this kid has. So the kid has a problem. So tell me a person doesn't have a problem.
Right. There's a very, very well-known psychologist named Ross Green. He's up at Harvard, and he's written several books. One is called The Intermittent Explosive Child, and it's all about the kids who have these extreme rages, and again, many of them eventually get known as bipolar, and how to deal with them. And he made a statement that has always just stayed in my head, and I tell almost every parent I work with, if your child could do well, if they could do well or do better, they would. So many of the parents that come into me think this is all so deliberate and so parent personalizes, feels the kid's trying to torture them, give them a hard time, and I haven't found it to be the case.